increasingly pervasive and to a great extent almost inexorable. So it's not surprising that in a global world, so to say, also health goods go global. And this is for a variety of reasons. Some eminent commentators such as Glenn Cohen or Guido Pennings are also recognizing that the problem of medical travel is linked to good sides, possible benefits for some healthcare systems. So if you outsource treatments to other countries, as it used to be the case in the UK, as we just heard. Now, in a recent topography of medical tourism, it was proposed that there exist at least 3 forms of medical tourism, as you see in the slide. So there is tourism for services that are illegal in both the patient's home and destination country. There is medical tourism for services that are illegal in the patient's home country but legal in the destination country. And finally, there is medical tourism for services that are legal in both. Now, stem cell tourism, at least of the kind that I described so far, seem somehow to fit in the second category, but not completely. Now, stem cell tourism is peculiar in another and possible more important way. Whereas the offer of unproven stem cell therapies is illegal both in Texas and in Italy, for example, the challenge posed by stem cell clinics and providers in these 2 locations actually causes cracks to open into the regulatory framework of each respective country. So in Texas, the Texas Medical Board basically opened up to the commercialization of unproven therapies, and in Italy the decree actually provided a way to access the treatments. So to wrap up, I would like to stress a couple of points. The first one is that in the 3 examples that I mentioned, it's always the case that mesenchymal stem cells are at stake. The second point is that this kind of stem cell tourism at least qualifies as regulatory tourism. And finally, stem cell tourism provoked some regulatory creep, some feedback into the origin countries. Now, in the last 2 minutes that I'm left with, I would like to make to share with you just a few more thoughts regarding the interpretation of the phenomena that we are talking about here. Now, the debate on medical tourism and on stem cell tourism in particular is actually dominated by the reiteration of the so-called deficit model, whereby the scientifically savior needs to step in to guide and to instruct the ignorant lay people as their activities cross the domains of science. Now, in stem cell tourism's debates, the deficit model actually plays out at the level of states and at a global scale. The deficit model is therefore reiterated across north-south or east-west geopolitical divides. It's sort of reassuring, if you think about it, to assimilate stem cell tourism to the practice of unorthodox medicine abroad, or to the quackery of dishonest practitioners, or even to the credulousness of scientifically literate patients. But on the other hand, however, this deficit model actually invigorates the narratives of those patients and of the providers who see enforcement activities as unduly paternalistic interferences with individual liberty and with the practice of medicine. So as a consequence, knowledge claims about efficacy and ethico-political ideas about therapeutic freedom get co-produced. Innovation policy and the practice of medicine become the site of articulation of complex narratives regarding individual agency and the role of the state in taking care of citizens, both at the national and at the global scale. So if we focus on the deficit model, this is my claim, and we disregard these dynamics of co-production, actually we fail to spot that regulatory standards, for example in the case of Texas or in the case of Italy, may be overdetermined by innovation strategies, so by the effort at making room for new medical products, whatever they are, and by the commercial interest of the providers. Having said that, I think that I can leave it here and thank my funders and you for your attention. Thank you.
Yeah, thank you very much for your presentation. Do we have any questions for Alessandro? So while you're still thinking about questions or comments, I wanted to ask you about there seems to be a real distrust of regulatory agencies, and kind of between patient groups and patients and kind of the state and kind of regulatory agencies. Can you talk a little bit about that? Why do you think that has come about, and do you think it's especially pronounced in this case because it's mesenchymal stem cells? So maybe there's a feeling that it's your own cells and not kind of drugs which being kind of chemically produced or kind of other medical procedures.
Yeah, I would start by commenting on the last part of your question. I mean, as a matter of fact, how can I say, the ontological uncertainty that surrounds stem cells, so the uncertainties as to what they are. Are they drugs? Are they body parts? Are they owned by patients? Are they the rightful object of regulatory activities? These uncertainties actually feed the aspirations of the patients and actually accommodate the idea that you can have access to a certain biological material because it originates from you. So this is certainly a characteristic to be taken into account when we try to make sense of what these people are actually seeking when they seek access to these kind of products. And this is not unique to mesenchymal stem cells because, first of all, mesenchymal stem cells, as any other cells, are retrievable from the body. The only technical fact that we have to think about when we speak about mesenchymal stem cells is that they are easily retrieved from the body. So with an aspiration of your fat tissue, you can actually start cultivating mesenchymal stem cells. So it's a material that is very easy to access from the body. Distrust with respect to regulatory agencies. I think that in this respect, probably, although I agree that we should be thinking in terms of networks to actually make sense of some of the dynamics here, I think that also looking at the national context is sort of helpful, and national political context in this case. I didn't make any generalization from the examples that I illustrated, but actually sticking to them, we could quite easily reconstruct a climate of political distrust towards regulatory authorities, both in Texas and in Italy, a distrust that is actually fed by nation-specific histories and nation-specific political conditions in this very moment. So I think that if we think about distrust towards regulation, we have to analyze the topic from a national perspective to be sure that what we say actually fits with the hypothesis that people are distrusting the authorities.
Just a really short remark about if we consider this kind of passions as voluntary research subjects of a new kind of medicine, for generative medicine, I'm just wondering, I'm asking if you can comment on that, how it's important to be part of cutting-edge biomedical research field. I mean, for example, the governor of Texas, if you quoted at the beginning of your talk, was seems to be so fascinated by the fact that was cured by cutting edge treatment. So, which is the role of imaginary, of science, of be part of this?
I think that actually the imaginary that is linked to the most advanced frontiers of science, in these cases plays out in two ways. First of all, it plays out in a very obvious way at the level of patients who actually are brought to believe that the most advanced frontiers of science are those that provide the best chances of treatment, whereas it tends to be the opposite in reality, because actually at the most advanced frontiers of science there is less proof of both safety and efficacy. So it's actually the good old standards that offer the highest chances of treatment. And the second dimension is actually the dimension of state strategies on innovation. So, of course, this promissory and inflationary language, as Neil was pointing out before, that is attached to science, plays out in a very prominent way as one of the elements that informs national investment strategies on certain domains of science. So in this country, for example, regenerative medicine is the object of a national plan of investment, and the House of Lords a couple of years ago issued a report that actually suggests that regenerative medicine is an area where public investment is needed in order to A, maintain UK leadership in this scientific domain, and B, exploit the economic promise of this field of science.
Well, yeah, I would like to thank you for sharing this interesting material with us, and then a comment which would, in fact, relate to both papers, which would be, a lot of these people are quite desperate, and I was just thinking that in what you're saying, there's a lot of good reasons for avoiding the word tourism altogether, and just basically say travel, and acknowledge that it's not, you know, like a little extra luxury thing, but it's people doing things when they see no other options as well. And I think that it relates to some really interesting things you said about legitimacy, because this is a group of people that are aiming to avoid protection, and a set of rules about aimed at protecting people against what is unproven, but without being able to say what is proven. So it's a particular area in which there are no standards for actually establishing proof. So in a sense, it raises the question of what is then honest and transparent advice to people, because it's almost as if there's a sense of a propaganda machine which just says this is wrong, but we can't say what is right. And in a sense that even seems to sustain the kind of legitimacy from the point of view of the traveling person, of aiming for setting your own standards of advice. So I was kind of thinking, building on what you said about avoiding a kind of a deficit model, if you would want to comment a bit upon, you know, what is honest and transparent advice when the epistemic footing of critique is in flux.
Yeah, I mean, thank you very much. That's very insightful comment and / question. And and first of all, yes, I think that in some cases using the word tourism may be a little bit inappropriate, at least in the cases of those families who have a child affected by a terrible disease, as it was for the majority of the patients seeking access to stamina inhibition. So that's something to think about. Yes, it's true that they are actually avoiding protection against the unproven, the point is that in our culture, in Western countries at least, it's not obvious that one could waive protection from the unproven on the part of regulatory agencies. I mean, I think that I'm not speaking from a legal point of view. I'm speaking from a cultural point of view. It's not obvious that we have clear-cut ethical ideals to guide us in this domain. So it's not obvious that we have entitlement, or that we are ready to recognize that we ourselves have entitlements to say no to certain kind of paternalistic protections on the part of public health agencies. So what is the kind of advice here for patients? Well, this is a hard question. I mean, it seems to me that actually the regulatory systems knows what would be the reasonable thing to say to this patient. And the reasonable thing is just to offer the options that are open, that is enrollment in clinical trials, lawful use of compassionate use or expanded access programs, and lawful use of off-label use of treatments. Now, outside of these three options, actually the regulator knows what to say to patients. It says no, you cannot do anything but these three things, even if you are desperate. And actually these options are available to desperate people. Now, the point is that in reality, the way in which these patients seek access to even the lawful options is not very much regular, in the sense that it's not usually your curing physician that encourages you to enroll in a clinical trial. More often, it is the patient or the family of the patient that seeks on the internet for available treatments and stumbles upon clinical trials. I've been interviewing practitioners in Italy doing amazing clinical trials with stem cells, and actually clinical trials that proved some safety and efficacy. And since these are just small studies that enroll 3 to 6 patients, obviously their email boxes are flooded with requests from other people. And I got access to these emails in an anonymized form in some cases, and it's a negotiation between the patient and the PI in this case that actually that is the site where recommendations flow or requests flow. I mean, we don't have to imagine that there is a third party or that there is necessarily a third party actually providing advice to patients. Sometimes the relationships that the patients install with the people who can provide some sort of treatment when they're desperate actually escapes the radar of the practice of medicine as we know it.
Thank you very much, Alexandra. Oh, sorry, Margaret has a question.
I'm sorry that I didn't hear the entire conversation. Listening to your discussion, I was wondering to what extent have you taken into account the mediation of patient organizations that are often used in order to get, well, they're often kind of non-tourist groups, but
yes.
Going abroad, and the patient organizations themselves seem to organize them. And I was also wondering, because of the medical tourism concept that, well, we don't really feel comfortable with, whether you're familiar with Priscilla Song's work on pilgrimages.
Mm-hmm.
She actually discusses this in a very serious form of last resort tourism.
Yeah.
And so the whole notion is different. And apart from that, I was wondering whether you're familiar with the new British guidelines, the early access to medicine scheme, that makes it possible for therapies that are still under research to be offered to British patients. So these are all developments.
I'm not familiar with this particular piece of guidance, but I mean, these kind of programs, as I said, exist in very many countries, and actually they give rise to very controversial issues. So, then the analogy with pilgrims going for religious trips as last resort trip, well, this is an interesting analogy. It can illuminate to some degree the kind of understanding that we have of this phenomenon, at least to one extent. So the point is that if we look at religious travels as last resort, we understand that even in highly knowledge-based societies, still certain rituals of care with respect to the hopeless actually are still taking place outside of the boundary of science, and they enjoy some form of recognition. So this is to challenge the idea that there is a gold standard in Western medicine. Actually, there is no gold standard, neither as to epistemology nor as to morality. Now, going back to your first point about patients' organizations, I noticed that in the cases that I analyzed, there are two forms of networking between patients that take place. One takes place upstream, so patients tend to join pressure groups, lobbies, especially in the States, and this is true in Texas, it's true all over the United States, and actually they press the legislator to pass facilitating regulations. And for example, there is a regenerative medicine bill that actually was introduced into the US Senate a few months ago after huge lobbying efforts by certain organizations. And the second form of networking that takes place is instead at the end of the pipeline. So when regulatory efforts get in the way of patients accessing unproven therapies, then patients start to organize. This is very visible in Italy, where umbrella groups actually grew stronger after the Italian regulatory agencies started to contrast the activity of stamina. But one thing is worth noticing, that these umbrella groups actually grouped around already existing network that were in most of the cases built around a single case. So it's a family of a single patient who doesn't have no other option, who creates a group on Facebook, and around this other groups actually join and try to build momentum and try to build critical mass.
Thank you very much, Alessandro. And last but certainly not least, I'd like to invite Kristen to give a presentation.
I'm going to take a bit more of a patient perspective on this, and maybe address a little bit of what we were just talking about, sort of the serious circumstances. So I'm going to actually start with a little vignette that I've made, but I'll talk about that in a second. Karen has spent the past week toting her 6-year-old daughter, Emily, from the family doctor's clinic to a specialist's office to the hospital for another round of tests, to the pharmacy, to physiotherapy, and to home again. Karen's husband, Matt, is there for brief intermissions to give Karen a break from caring for Emily's extensive needs and administering her long list of medications. But Matt is working 3 jobs to keep the mortgage paid, since Karen no longer works, in order to give their daughter the full-time care she needs. Emily was diagnosed with Batten's disease last year. There's no real treatment and definitely no cure. The average life expectancy of someone living with juvenile Batten's disease is early 20s at best. The rare times that Emily is sleeping soundly or not needing Karen's attention, Karen spends her time educating herself about the disease, researching what work is being done on the disease, and connecting with other parents around the world whose children also have Batten's disease. So the story is fictional, but it follows the common pattern of stories we hear about people going for stem cell tourism that we see in newspapers and on blog posts and a lot of other public forums. I just lost my spot. Anyway, despite being fictional though, the many stories that are being told like this that are real do provide some perspective on the social networks that build up around stem cell tourism. And as we were just talking, it's a term that is criticized for sort of trivializing the often serious circumstances that people who are seeking these treatments are facing. So the nature of the industry of stem cell tourism is that it is very difficult to know anything about it. Clinics that offer these treatments are often not forthcoming about their practices and clients, and gathering any real or reliable information about the size and demographics of the population who are seeking these treatments is almost impossible at this point. Much less is it possible to know how many people even just consider or research the option for direct-to-consumer stem cell therapy. However, some research has been done to better understand who is seeking these treatments and what their treatments actually entail. And much of this research relies on data or information that is publicly available. So in addition to learning more about who is seeking stem cell therapies and what these therapies might entail, because much of this research looks at sources that are widely available to anyone in the public, we can also learn a lot about the information that is available to potential consumers in the industry, as well as some of the social networking that is behind the phenomenon. So now, this term social networking in its more current use refers to specific internet technology that allows for collaboration and control. But I'm using it to refer to a complex group of interconnected people whose connections are based on shared experiences. So in this case, it's the experience of illness and seeking options and information about your health. So we know from research, other research that social networks, in this more general definition, play an important role in health and medicine. And this includes how healthy or unhealthy behaviors as well as health outcomes can spread in social networks, and this include attitudes towards health as well. So this can help provide some insight into how a market for unproven direct-to-consumer stem cell therapies persists and even grows as the shared experiences, attitudes, and behaviors of patients and their caregivers spread through their networks. So the social networks that develop around shared health experiences are often facilitated by the internet. And the internet is an increasingly popular method for seeking any kind of information, including health and medical information. And given that stem cell therapy market is a global phenomenon, it is conceivable that much of the information available to potential patients and the social networks that form through this information sharing experience will be largely web-based. So it is important to note, though, that patients and or their caregivers who are considering direct-to-consumer stem cell therapies bring a wealth of knowledge, experience, and unique situations to their research. Patients and their caregivers are not passive receptors of this web-based information, and they often hold expertise about their own health beyond what a layperson would be expected to know. So let's take a closer look at some of the sources that have been, or some of the research sources that have been looked at. So first, one of the more direct means that potential patients have for learning about their options for stem cell therapy is through websites for clinics that offer these therapies. So clinic websites can vary widely in the amount of detail they provide about their clinics and their treatments, and some clinics even include extensive patient testimonials, or they host blogs written by patients who can track their treatment during and after their recovery process. And so one of the very first articles to actually be published on the phenomenon of stem cell tourism included a content analysis of 19 websites. And the authors compared the treatments that were being advertised to the peer-reviewed evidence for the clinical use of stem cell therapy that was available in 2007 when the study was conducted. And a follow-up study was published last year that I was involved in that re-examined 18 of the clinics from the original study and then included an additional 12 clinics. And the comparison of these studies basically found that clinics overall tend to portray stem cell therapy as safe, effective, and ready for routine use. And often the stem cell therapy can be used to address a staggering variety of diseases and conditions. And there wasn't really any difference between 2007 and 2012. However, there were some noteworthy changes in the content of the websites from 2007 to 2012. First, the website seemed to include more lists of publications and patents, And they were more extensive descriptions of the treatment details, or even just information about stem cell science in general. And also many websites also provide information about the medical professionals at the clinic, as well as their qualifications that they have. And so finally, the websites themselves appear to become a bit more sophisticated and aesthetically pleasing, though it's hard to know if that's just because in general we know a lot more about the internet, and probably any website is going to be more sophisticated now than in 2007. Anyway, from the perspective of patients seeking medical alternatives, the existence of academic publications, patents, and detailed explanations of stem cell science and procedures gives clinics a heightened sense of credibility and possibly even safety and efficacy. By listing physicians and their reported qualifications on websites, there may also be an increased sense of patient safety and trust in the clinics. So next we have educational materials. So with the rise of popularity and also concern with stem cell tourism, a number of web-based educational materials have been produced for potential patients in order to help them make informed decisions regarding these options. These materials are produced by organizations such as the ISSCR or research networks, like in Canada we have the Stem Cell Network, which funds a lot of stem cell research, and patient advocacy groups like the Multiple Sclerosis Society. So a colleague of mine, Zubin Master, recently conducted a study that compared the educational materials available from these different organizations. And he compared the content about the state of stem cell science, the ethics and policy issues related to stem cell science, and about treatments and unproven interventions that use stem cells. So the results show that scientific societies and research networks are more likely than patient advocacy organizations to provide information about stem cell science, ethics, and policy issues. And less than half of the patient advocacy groups included in the study provided any educational content regarding stem cell science. And interestingly, material that directly addressed direct-to-consumer stem cell therapies were rare for all of these organizations. Now, it's conceivable that patients researching their options for stem cell therapy would be more likely to turn to a patient advocacy group than a scientific, that they already identify, than a scientific society. However, as mentioned previously, it's difficult to know and study the actual population who are considering and pursuing these treatments. So we don't really know at this point if that would be true. But regardless of which kind of organization a potential patient would turn to, there appears to be very little information about the efficacy, safety, and risks of traveling to another country for direct-to-consumer stem cell therapy. And for the educational materials that did provide information regarding the state of stem cell science, there's a lack of potentially valuable information for patients regarding the knowledge translation process and how long it might actually take for stem cell science to go from the lab to the clinic. So next we have news media. So the news media is one of the biggest ways to get health information for people, at least in Western countries. And we also know that the framing of news coverage has an impact on public perceptions of different health issues. So the newspaper coverage of stem cell tourism, at least in Canada and the US and the UK, has been largely positive, and it tends to focus on individual experiences, and it's on primarily successful experiences at clinics. And the news media rarely reports on the potential risks of seeking these treatments, the ethics and policy issues associated with these treatments, nor do they cover stories about patients who either had adverse reactions to a treatment or had no reaction whatsoever to treatment. So another study was conducted not too long ago that analyzed newspaper coverage in China, which is one of the most common destinations for stem cell tourism. And the news media in China also framed these treatments as largely positive and as useful for addressing a wide variety of health concerns. So with the news media framing unproven direct-to-consumer stem cell therapies as a mostly positive and a successful experience for individual patients, the potential health and financial risks of seeking these treatments become minimized. For patients researching this option, news coverage may help bolster the idea that direct-to-consumer stem cell therapy may provide more hope than risk. Now I'm going to look at a couple more traditional, or what we can, maybe should say current view of what we call social networking. So one of the ways that patients build their social networks is through writing and reading blogs that include posts about the process of researching, traveling to, undergoing, and recovering from treatments at clinics. And these blogs provide insight into the motivations, perspectives, and experiences of patients who have either considered or have pursued this option. So studies of blogs written by patients or their caregivers show that patients who have often exhausted all available options in their home countries, as we've discussed, and that they often feel that they have nothing left to lose by trying direct-to-consumer stem cell therapy. Many authors of these blogs also express a steadfast hope in the power of stem cells, even when their experiences at the clinic or the results of their procedures were not entirely positive. So this hope is often based on what appears to be extensive research that many patients undergo or conduct. And in fact, it appears that many blog authors who wrote the blogs actually consider themselves fairly well educated about stem cell science. So the blogs provide insight also into the social networks that patients have begun to develop around this experience. And so many blogs will mention other blogs written by patients that have also already gone, or they'll talk about, the blogs will mention discussions that happen with other patients that they've met that have gone for treatment, and how that affects their choice to go and to look into that option. So as research on the role of social networks in health has suggested, connections between past and potential patients, whether by reading blogs or writing blogs, may help information and attitudes towards unproven direct-to-consumer stem cell therapies to spread. And so finally, a note on Twitter. So it's a more recent research that's been done by my research team in Canada. So it was published, it examined 363 tweets made either by the stem cell therapy providers or in which one of these providers were mentioned. And so similar to clinic websites and newspaper coverage, these tweets largely portrayed stem cell therapies as beneficial and safe and mentioned treatments for a wide range of diseases and conditions for which there's very little evidence for clinical use. So a note on hype. Well, each of these resources available to potential patients differ considerably in their focus, purpose, and in how patients might interact with the information provided. A common thread running through all of these resources is the lack of critical assessment of the efficacy and safety of unproven direct-to-consumer stem cell therapies. In other words, it appears that the hype around stem cells exists within and is propagated by many of these resources available to patients and spreads throughout the social networks that have developed around stem cell tourism. By hype, I refer to the ways in which scientific information becomes exaggerated, either by its value to society or the length of time for this value to reach society. So scientific hype can be attributed to a number of factors, along what Caulfield and Condit have termed the hype pipeline, which implicates scientists, universities, publications, and the media. And based on some of the stuff I've just presented, we can probably include blogs and Twitter in that hype pipeline. So just to wrap up, well, it's not an exhaustive list. The resources I mentioned today, so the clinic websites, educational material, news media, patient blogs, and Twitter, are all resources that patients might consume that also contribute to building a social network of patients who are considering or have received direct-to-consumer stem cell therapy. While social networks can undoubtedly play an important role in health and well-being, the information about and attitudes towards unproven direct-to-consumer stem cell therapy also spread in the same way. It may be important to encourage the development of resources that include more balanced portrayals, that include the risks and ethical issues associated with stem cell therapy. But as the hype pipeline suggests, this change may need to begin within the scientific community and the messages it conveys about the promises of stem cells. Of course, there are many other ways that people may seek out information to help them make decisions regarding seeking stem cell treatments. And while it's very difficult to determine who has received a stem cell treatment or who has even considered it, further research that explores public perceptions of many of the resources that I have just talked about would provide insight into how potential patient might interpret and interact with a variety of messages about direct-to-consumer stem cell treatments. Thank you.
Did you also look into the like radio broadcasting or television talk show, something like that?
No, we haven't. We've talked about doing that, but it's very difficult to get access to some of that. It's sort of overcoming more the methodological issues of doing that kind of research. But it would be definitely some TV, like news, special things would be very interesting, but unfortunately we haven't been able to do that at this point. Hopefully in the future we can figure out how to do that properly.
Yeah, I have a question. Thank you very much, very interesting. And it's actually a couple of questions. So the first one is, did you notice over time a change in the public representation of this therapeutic potential in some of the media or in some specific media that you analyze? I'm asking this because in my Italian story, actually the public media discourse was at the beginning very favorable to the patient, and then a couple of major newspapers actually changed their mind and actually started to be less neutral and more adversarial to these patients because they didn't want to be associated with quacks.
Right. So with the news media specifically, we haven't, so that study was done in 2009, and we haven't done a follow-up study to know, but just more on an anecdotal level, looking at least newspapers in Canada that I have more regular access to. I would say it is changing. That there is a bit more, there's more stories being reported of things happening to people that do pursue treatment. We've heard some about, the boy who, or not, I'm thinking, somebody mentioned, I don't know when today, about, somebody getting, the bone structure sort of developing with more of a cosmetic process. But you hear lots of stories about tumors developing and all those types of things. And so I think those things are getting reported more often. I don't know what the motivation of the journalists would be. But I would say it is changing. It would be very interesting to go and kind of do a follow-up on that. I think it depends on, if we look at, something like Twitter that is relatively new, and the study was just published a couple months ago, there's no difference, like it's still very kind of an uncritical, this is great, yeah, rah, rah, rah. But they were also looking at the tweets that were put out by the businesses themselves, and so, or people who mentioned those. So it's a little bit harder to know if there's another side of it that, that my research team wasn't able to kind of discover on Twitter with that. So, and the problem with some of this research is just, the internet's constantly, it's so hard to properly, look at that and follow it. But.
And I had a second point, if I may, on the part of your analysis that was done on patient blogs, and you mentioned the fact that especially those who have exhausted any available therapeutic option actually describe their situation like having nothing else to lose. And I encountered this trope over and over in discussions about these kind of phenomena. And I was wondering if you have a comment on the fact that this trope is also present for example, in the guidelines of the International Society for Stem Cell Research. I mean, it's not specific to patients who feel desperate. It's actually also something that is present in the ethics of present-day medicine as a justificatory device for taking additional risks.
Right. I haven't really looked at that other than in the blogs, that sort of sentiment. But I think, when we look at a comparison of a patient who is, or a caregiver who is caring for somebody who is very sick and feels like they don't have options versus a regulatory institution or the ISSCR, their goals are very different. The way they're experiencing that thing is so different that even when some of that language is the same, I think the whole context and the motivation for using that language is so different that it's hard to really properly compare those, I think.
Yeah, I mean, that was the sense of my comment. I mean, that people attach different meanings to this trope, but it circulates as a piece of discourse.
Yeah, it is definitely, kind of a repeating discourse, but I think it's, I don't know, I haven't actually investigated that, but it'd be a great thing to look at.
sense of how the different mediums are used by patients. For example, the educational resources, the patient blogs, Twitters. I remember a talk with Ruth Holiday, who kind of looked at the cosmetic tourism, and she said, you know, patients would look at the company's websites, but they felt that they could trust kind of Facebook groups more in a way, because they could attach kind of, these are real people through Facebook.
I think that's the difficulty is we don't really know who's going, and so we can't. I would love to be able to do a study that actually looks at how patients do interact with things. What do they look at? We can only make assumptions and hope. And you know, some of it's obvious. We know that somebody's going to use Twitter or Facebook very differently than going out and seeking educational materials about it. So, but it's hard to know really how, you know, unless you're doing that yourself, or we can, but it's very, very hard to find people who either have gone through the process. If you can find them, they're often not very willing to participate in any kind of research. So I can only assume, but really we don't know at this point, and so that's the difficulty of studying stem cell tourism, is we don't have any real meaty things to actually, you know, we kind of have to go in these back doors and like, okay, well if we look at it this way, maybe this is going to be a proxy of what's happening, but we don't really know. And
do you get a sense though, because you talked about a lot of activity, do you get a sense of how big the community is? In Canada, for example.
In Canada, I would say it's not as big as a lot of people like to say it is. My sense is it's.
But give us a number.
Okay, well, exactly 723 people in Canada. No, you know, looking at the blogs, and when I was trying to look for blogs, and then looking at when they start interacting and talking about other people, it's actually, I think, quite a small community globally. In Canada, we're probably, I would say it's less than 100 that really honestly, seriously look into it and go and do that. Some of it might depend on your healthcare systems at your home, but it's not covered by at least the Canadian healthcare system. It absolutely wouldn't be. And so that's, even if it crosses somebody's mind to look into that, it's so like prohibitively expensive that people are remortgaging their homes. They're having to, as you know, I said in my little vignette at the beginning, people are taking on extra jobs just to pay for this thing. But you start to see the same names and the same stories coming up more and more. That makes me think that it's probably a smaller community than sometimes the media will have us believe, because it seems to be the same people. But whether those are just the people that happen to talk or tell their story, and there might, it's really hard to know. But I don't think it's thousands upon thousands.
When they're telling the stories, do you ever get a sense of, and I suppose testimonials as well, about the authenticity and you know, and differences across that?
Often the stories are based on I felt cared for, you know. So it's more of a somebody finally listened to me and took me seriously, let me make decisions about my own health care. They don't do that at home. They're often very distrusting about the research that is happening in their home countries or the medical care in their home countries. And so you go to a clinic where you get to help make decisions like, no, I want 5 injections this week of stem cells, and I can make that decision myself, and how almost sort of the credibility of that kind of goes out the door when they just feel like somebody's finally listening to me and trying to do something. And
we found some very interesting, the outcomes agenda is very, very, very complex, isn't it? But you know, we had bariatric patients who, their clinical outcomes were terrible. They you know, people were really quite poor.
Oh, yeah.
They hadn't been, but they had taken responsibility, and they judged the treatment a success.
Oh,
yeah. It's about taking control.
Absolutely the same in the blogs. Yeah. You know, for patients that do write their blogs for a long time after their treatments, where it just, you know, you read it for a whole year after this, you know, 3 trips they took to China, and you know, the only thing they can say is, I had that 1 week where I felt a little bit more energy, but still, despite that being the only thing that comes up, they'll just be, but I know this is the future, and this is, you know, this is like, there's just sort of this belief that this is the answer somehow. It didn't work for me this time, but you know, we're going to get there, and it's going to work for other people. And there's just kind of that need to hold on to hope, really.
Could I ask as well whether you see the kind of companies websites trying to link up to or try to appropriate the kind of favorable blogs or tweets or something like that?
So there's, well, one, I don't know if I can name names, but there's one clinic in particular in China that hosts actual blogs. So I think you get, like, it's not that they will take patient blogs and just link it. It's an actual like forum for that. And I think most the clinics that do have that kind of thing, it's hosted by that website. So they wouldn't necessarily link to outside stuff. And there are stories about one of the blogs that there was 2 blogs in my study that did come to the conclusion that this is bogus, or it didn't do anything for me, it was a waste of my money. And so one of those patients had gone to this particular Chinese clinic and was basically, his blog was pulled because he started to put negative things on there saying that, I haven't experienced any. And so that blog was actually no longer available on the clinic website. So it's sort of the clinics themselves curate whose blogs are allowed to be there, whose testimonials get to be there. So yeah, but I didn't really see anything like linking to like outside, like somebody has their blog spot and then the clinic link to it.
It's just that I came across the example from the fresh cell tourism that somebody blogged about it, and then later the daughter of that person became a representative for the clinic.
Oh, interesting. And maybe that happens, but yeah, I haven't seen maybe those types of connections, but yeah.
Yes, what happens?
Yeah. I wanted to comment along on this thing of the importance of agency and the sense of care. I thought that's really essential to understand the phenomenon. But in an uncanny sense, it also resonated with something I started thinking of when Alessandro was presenting, which was Tolstoy's remark in Anna Karenina, that being a good doctor is basically about giving people the sense that they are cared for and that they are doing as much as they can without actually harming the patient in the process. And in an uncanny way, it's like this pre-evidence-based medicine kind of thing is having a return here. But basically, I'm really impressed with all the different pieces of work that you've done. But when you end up saying this thing of it's important to explore what public perceptions, it also raises this old Lippmann question back from the 1920s of what is a public? I mean, basically, who is the public? And who can speak on behalf of them?
And it might be, instead of saying public, I should maybe say patient perspective.
Exactly, because I mean, in particular ways, also even when you make the remark that patients, based on your study of the patient blogs, that patient feel a sense of a need to be more engaged and participatory and all of that. It's also a particular group of patients. It's the ones who don't feel cared for. It's the ones who don't feel a room for their agency. Whereas you would find other patients who are feeling pretty confused by informed choice, informed consent, blah blah. All different kind of things which they see as lacking guidance. So in a sense, we can sometimes become complicit in making ourselves spokesmen for a particular public.
No, it's true.
And I was just wondering of your thoughts about, how do we construe a public and who can speak on behalf of them?
We don't know who these people are, so it is I kind of have to say all these sort of assumptions. I don't think that's a word, but kind of make a lot of statements that are assuming who we're talking about, but we don't really know. We have no idea how many people they are, who they are, do they have any sort of common demographic or perspective or opinion on medical care. We don't, who knows? And so it's really, I do need to get careful.
They might change over time.
It might very much change.
Situational things.
And from what I have been able to at least determine through looking at all these different forums is it often is really just spread through, I know somebody who also did this, or there's that other person who has the same disease, especially if it's a rare disease, they're often very connected, to the 20 other people in your country that might have that disease, and they share information that way. So it might change in that way. It might go from somebody who's very suspicious of healthcare just to we're hearing more and more about it. I'm not suspicious of my healthcare, but it's one other option. But it's a lot of assumptions right now that it would be great if we could find out a bit more, you know, how big this group is, how do they think, is there anything common about any of them? Yeah, who is that public, or who are those, you know, potential patients? And I don't, honestly at this point, I don't know how we're supposed to go. Any sort of attempt that our research team has tried to do has just fallen absolutely flat. And I don't know if that answers your question at all.
Well, it's certainly steps towards it, but I would think, I would suggest also not thinking about publics as kind of, you know, fixed entities with particular positions.
Well,
that's in a more processual.
I think I was hoping to maybe at the beginning say, you know, like these are people that have a lot of, they have their own unique experiences and situations and perspectives on things that they're bringing into it. It is not a homogenous group of whatever, you know, of people, you know, and so I'm looking at these things from my perspective, but they're all everyone's going to interact with that material differently. It's going to take in different messages from material. So it's sort of a matter of, I have to acknowledge the fact that yes, who knows who this public is or these patients are. And I do have to acknowledge that they're all going to interact and understand stuff differently and take it in differently and process it differently. But I don't know at this point how that happens. So.
Yeah, I had a just quick follow-up on Klaus' point. To the extent that I followed the articulation of, the self-articulation of these narratives on blogs and websites, in the case that I studied, actually it appeared to me that some of these patients group are actually trying to portray themselves as public. So some of the activities that they are doing, the narrative activities that they're doing, like writing books or participating to talk shows or writing blogs and so on and so forth, or just accepting interviews from journalists. In these activities that very much construct their group as a public, in the very sense of the Lipton-Dewey debate that you mentioned. And if they are not, are they aware of it? I don't know. I think that they are aware of the fact that they can be a constituency to the activities of the state and regulators. And as a matter of fact, there is a lot of variation in terms of those groups that have a longer relationship with science. For example, the Teleton network in Italy, which has been funding cutting-edge research for decades now, was very adversarial with, in the stamina case, with the claims of the providers of interval therapies, whereas other groups were acting differently, and each was trying to construct themselves as the legitimate public of legislative and regulatory action. That's my perspective.
Okay, thank you very much, Kristen. I think we've kind of run out of time a little bit, so I'd like to thank